And today, a conversation with orthopedic specialist Dr. Andrew Islam. He joins us from TriHealth's Good Samaritan Hospital with some great COVID and general injury prevention ideas. And I had to ask, how excited are you for opening day?
Oh, I think we all are, right? I mean, it's been delayed for a few months. I think we're all excited to see some form of professional sports return, like we mentioned, just for some degree of normalcy and entertainment even.
Yeah, it is an entertaining sport because, I mean, we got the best here. We got to show you that we are here with Mr. Redlegs. We're keeping our distance, but he's even wearing a mask, a good lesson. So in your teams that have started, are you seeing injuries because maybe we didn't train as much as we should have?
We have seen some of that. We have seen some injuries just because people were off completely and not doing their off-season routines, as we call it. So they kind of accelerated a little too quickly, so we have seen a little bit of that. Obviously, contact has been limited, so we haven't seen what we call our high-energy injuries at all.
Yeah, so with the limited contact, are you learning along the way sort of how we should be playing sports right now in the middle of a pandemic?
Oh, yeah, I think we're learning along the way everything, related to this pandemic, not just in the sports, but we are doing different things to minimize exposure in the athletes. Obviously, we're still waiting on guidelines to come for fall sports from the state itself on how we'll actually do it for actual games if that occurs.
So did you mention that you're trying to sort of keep certain members of the team together? How is that working out?
Yeah, so at some of our high schools, at least that we're in charge of the care, what we've been doing is creating what we call pods. So 8 to 10 athletes in one pod, and that's who they practice with every day. And we don't cross athletes between that, so that if there is an exposure, we know exactly who to quarantine, who to keep separate. But it allows them to start their practice and training.
You have to kind of pick up the pieces from some of these injuries. So I guess if we're all watching, the thing we want to know is, how do I not get that knee injury? How do I not get that elbow injury? Do you have a secret for that?
Oh no, I wish I did. Yeah. I think the main thing is training correctly, stretching, rehabbing, etc., to avoid and minimize your risk of it. You can never make it zero.
Yeah, and I know that along the way we've needed your guidance. So I guess final thing, when you think of like baseball season starting from a sports medicine thing in this time, what are the overwhelming things you're like, we need to be sharing this with people, but everything is benefit versus risk and you treat the whole person? Getting back to sports is really important, is it not?
It is. I think it's important for people's physical well-being, their mental well-being, even social well-being. So it is important to get out there and do these things. Obviously, maintaining the proper precautions and being aware if you have been exposed, so that you don't expose other individuals. So.
We would love to know what you're talking about. You can reach out, anything coronavirus, other health questions. We'd love to hear from you. Shoot me an email, hit me up on Facebook or Twitter.